and welcome back to the AQA GCSE History, Britain Health and the People revision series. This is episode 3 and we're looking at treating disease in the Middle Ages. Many believed that disease was a punishment from God and people who were sick were encouraged to pray. The sick prayed to saints in the hope that it would stop the illness. Medieval people also believed in pilgrimages and holy shrines. Even many of the doctors had superstitious beliefs. For example, many used astrology to diagnose and treat illness, and others believed that saying certain words while giving treatment would make it more effective. Others took their repentance one step further in the form of flagellation, which is where they whipped themselves in public in order to show God that they were sorry for their sins. This was particularly common during the epidemics, for example, the Black Death. Bloodletting and purging were both very popular treatments, as they aimed to balance the four humours. For example, if someone had too much blood inside them, the doctor would take the blood out of their bodies via bloodletting. They would do this by making small cuts to remove the blood or by using blood-sucking leeches. However, bloodletting was very dangerous, and some people were accidentally killed because too much blood was taken. Purging was the act of getting rid of other fluids in the body by excreting them. For example, doctors gave patients laxatives to help in the purging process. Medical surgery was incredibly dangerous. There was no way to prevent loss of blood, infection, or pain. Therefore, it was only attempted with very minor procedures, for example treating hernias or cataracts. There were few university-trained and highly paid surgeons, but surgery is not a very well-respected profession in medieval times. Most of the operations were carried out by barber surgeons. The Miasma theory led people to believe in the power of purifying and cleansing air to prevent sickness and improve hygiene and health. Many doctors carried posies and oranges around with them when they were visiting and treating patients in an attempt to protect themselves against catching any of the diseases. During the Black Death, juniper, myrrh and incense were all burned so the scent would fill the room and prevent the bad air from bringing any diseases inside. Remedies were brought from an apothecary, local wise women, or were made at home by hand. These remedies contained herbs, spices, animal parts and minerals and were very popular in medieval Britain. These remedies were passed down in generations or written in books which explains how to mix the herbs. These books were sometimes known as herbals. Other remedies were based on superstitions, such as lucky charms containing powdered unicorn horns. Many people used lots of different healers. Physicians were male doctors who trained at university for at least 7 years. To train, they read ancient texts as well as writings from the Islamic world, but their training involved little practical experience. They used handbooks and clinical observations to check the patient's conditions. In the 1300s, there were less than 100 physicians in England, and they were very expensive. Many people saw an apothecary. They prepared and sold remedies. They also gave advice on how best to use them. Apothecaries were the most common form of treatment in Britain, as they were the most accessible for those who couldn't afford a physician. Apothecaries were trained through apprenticeships. Most apothecaries were men, but there were also so-called wise women who sold remedies as well. Most public hospitals were set up and run by the church. There were relatively few of these hospitals, but they were extremely popular. The main purpose of the hospitals was not to treat disease, but to care for the sick and elderly. Hospitals provided patients with free water and a warm place to stay. Most hospitals were also more hygienic than elsewhere, because they developed water and sewage systems. Some monasteries also cared for the sick, elderly and the poor, but most people were treated at home by a family member. Hugh of Lucca and his son Theodoric worked as surgeons in Italy in the early 13th century. They recognised the importance of practical experiments and observations. They also questioned some of Galen's ideas. These Italian surgeons began by dressing wounds with bandages soaked in wine, as they noticed it helped to keep the wound clean and prevent infection. It's important to note that they made the discovery by chance. They also realised that pus was not a healthy sign, unlike other doctors at the time who might try to cause pus because they believed that it was released toxins from the body. So that's the end of episode 3 of the AQA GCSE History, Britain Health and the People revision series. Next episode we'll be looking at improving hygiene in the Middle Ages. Thank you for watching, and I hope you enjoyed. Please remember to like, subscribe and leave any questions in the comments below.